Hi, good afternoon. Good afternoon to everybody who's watching us remotely. It's a pleasure to be the moderator of this discussion with such honorable guests. I want to thank the organizers for inviting me to be here as well. As they've been introduced, we have two guests with us, José Marcelo Oliveira, CEO of the Oswaldo Cruz Hospital, and Edson Pereira, CEO for the Fresenius Medical Care in Brazil. Over the last 2 years, we saw a radical change about the concept of remote work. Remote work has always been a discussion in most companies, but it hit us as a devastating wave in all sectors over the last 2 years, and the healthcare sector was no different. Not only the production chain, the sector that produces, but also the healthcare industry, whose main characteristic has always been treating patients. And a lot happened during these last 2 years that led us to discuss and think about remote work and the connection between doctors and patients and new forms of connection, which brings us to this extremely rich discussion. We'll have a conversation with our guests talking about their experience and this perspective about the future of remote work in healthcare. From different perspectives. We'll have 10 minutes for each of our guests to explain and give us some examples of their experiences, and then we'll have 10 more minutes for questions. And of course, we can also take questions from the audience, and for that, please use the chat box. Now, I'll give the floor to Dr. José Marcelo Oliveira, the CEO of the Oswaldo Cruz Hospital. Thank you for your presence. You have 10 minutes. Thank you, Alexandre, for your moderation and for the kind introduction. I also want to thank the organizers for the invitation. It is a pleasure to be here talking about such pressing subjects for the healthcare scenario. Our goal, of course, is to grow this industry in the best possible manner. Of course, taking into account sustainability. Remote work is, of course, a sustainability tool for us healthcare providers. The Oswaldo Cruz Hospital is a high complexity medical center, and it was under a huge demand of patients looking for acute care after the pandemic, and it also had to remain active caring for other medical conditions in addition to COVID, such as heart diseases, cancer, and whatnot. So the experience that we can share is that at the beginning of the pandemic, disruptions such as the one that we experienced, and actually every industry experienced that, we had to react against the implementation of remote work because it was not part of our short-term plans. That was how the industry thought. And of course, that was already a change that was being slowly implemented, and working models associating that with the better lifestyle, more efficiency, more rational use of spaces. So it was not totally foreign as a discussion, but in practice, we initially reacted against that. And that created a perception that really concerned me as a manager, as an administrator of a high complexity hospital, which is to think about how can the culture of our institution deal with that situation, because not everybody could do remote work and work from home, because the very nature of our services requires that we are at the front end. So it was usually the back office team that was able to experience that setting. And initially, our concern was that, well, why can only a few of us work from home and not everyone? And that is something that happens if you're not totally planning for launching a huge change like this. So introducing this discussion was mandatory because that was in line of the best practices to contain the pandemic, which involved reducing the circulation of individuals. But there was also a certain association with privileges, and that was highly concerning for us. So the implementation of that scenario required a lot of communication and a lot of goodwill from everybody, people who had to be at the hospital and people who could be working from home. Because for on the one hand, people that were working from home felt away from the institution. It's just normal for us healthcare professionals to enjoy contact with our friends and colleagues. So we evolved a lot from this initial moment of reactivity towards a second phase that was more structuring, so to speak, where institutions started to provide resources and to think, well, this modality is here to stay. So which teams are eligible for that? And what are the models that we're going to adopt? And this initiated a discussion around designing the model where the institution will provide methods, resources, and support, and will review its policies and establish new ones. Several professionals, and according to our experience, have been trying to check if they'll have the possibility of working remotely when changing jobs, because that makes better use of time. Displacement in Sao Paulo, in Rio, and other capitals, other big cities is always a concern and a challenge. So we started getting aligned to that way of thinking. And we have a work group with internal groups that collect people's perceptions, and also big institutions sharing best practices, and that involves the entire healthcare sector. And to try to give you a more objective data between benefits and disadvantages, what we've been able to see is that there's a positive impact on the team as a whole when we're able to offer that. And that will become point of attraction to some of our workers. The hybrid model will probably be a better match for this future that we will define, where professionals will have to work from the hospital 2 to 3 times per week, and there'll be a rotation. We can also see that during job interviews, collaborators, new hires already started asking us about that. Managers have to be prepared to learn to lead in this environment where a visual contact is secondary, but they also have to be able to promote interaction between the virtual team by mixing virtual activities with a regular routine. So what are our concerns? How can we design the ultimate support to these activities? What are the risks of these activities in this new model? Controlling the working hours, interactivity, and so forth. There's also the fact that the routine is tiring. I think we've all seen that. You don't have breaks, and you have meeting after meeting, and working hours are long, and emotional stress is not negligible in that regard. And the quality of connections and this virtual interaction, so that we don't lose sight of efficiency in this new setting. And there are no doubts that it does provide benefits. Digital platforms are transforming our lives, both as individuals and as professionals. So it is a context that, in my opinion, is favorable to transformation, but it requires preparedness and requires thinking about how to advance with the workforce that was used to a more traditional model. And hospitals, which are the highest complexity institutions, are more traditional. During the time that I worked with diagnostic medicine, it was actually a different environment, because you can have a little bit more flexibility because your level of interaction with patients is lower. But in a high complexity center, all of the collaborators experience the intensity of urgency of an environment where you have to make quick decisions, regardless of whether you are working physically or remotely. You have to make faster decisions. If you think about a back office activity in a hospital to authorize a procedure, for instance, okay, that is a quote unquote bureaucratic activity, but it happens with patients that are in the ER waiting for an authorization to be sent to an ICU. So we have to work with that time frame, the entire group of workers, and that puts pressure on the system, regardless of whether you're working from home or from the office. And a second element to get us started in the discussion is that patients also demand remote services. So this organizational capacity to interact with people remotely tends to increase. The process of screening before the patient goes to the ER, remote monitoring of signs and symptoms, interactions, telemedicine, electronic prescriptions. This entire environment is here to stay, the way I see it, because it adds value, and institutions will move towards that as organizations. So, Alexandre, to get us started in this discussion, those were my words, and this is how I see things. And I'll give the floor back to you. That was great. Thank you, José Marcelo. And there's a survey that was published this week, or end of last week, mentioning that over 2/3 of women intend to switch jobs if they don't get more flexible conditions. Of course, that's a much broader survey, more generic, but those are very representative numbers, which connects back to one of the things that you said about the fact that there are possibilities of transforming the context, and that's connected to all other digital transformations. So thank you for the discussion. And now I'll give the floor to Edson, who is the leader in Brazil of a multinational company that's present in several countries. And in the production chain, they're also linked to a highly critical line of work due to the conditions that the company deals with for renal patients. So, Edson, I'd like to hear it from you about what this period was like and how you see a transformation in healthcare moving forward. Thank you. I want to thank José and the FIS team for the invitation. It's an honor to have the possibility of discussing ideas and the future of remote work with you. Maybe not everybody knows the Fresenius group, so I want to explain what that is. We are one of the biggest healthcare companies in the world, as you said. We are present in 150 countries. We have over 30,000 collaborators, and that's a pretty broad portfolio with pharma products, medical devices, equipment, and we also provide services with our medical care division. And I'm the CEO for that division. We treat around 110,000 patients. We have a hospital division, Elios, that's quite large, with around 150 hospitals in Europe, in addition to several low complexity clinics. And I think I should also mention that this year, we reached the 5th place in the global ranking of healthcare and the development of technology. And before we talk about remote work, Alexandre, I want to give a bit of context about our situation in Brazil. And I'll make a connection with remote work to make it clear that the need for us to advance in that regard is high. Dialysis, we have huge challenges in Brazil. To give you an idea, only 7% of Brazil's municipalities have a dialysis center, which requires patients to travel for hours, kilometers, to get treatment. Another important aspect is the scarcity of specialized doctors. In Brazil, we have around 4,700 nephrologists that represent less than 1% of active doctors. If we consider that around 10% of the population has some level of kidney dysfunction, to get adequate care, we would require at least twice as many professionals. So it's a specialty that's been attracting few young physicians. Many residency programs, even in large centers such as Rio de Janeiro, will go without a candidate for years. And just as with any chronic disease, given the aging of the population, the number of renal patients has substantially increased in the last decade by 70%. We have around 150,000 people being treated chronically. But if we make a connection with other neighboring countries in Latin America, given the size of the population, we should have at least twice as many renal patients. And we simply do not find these patients because they're dying due to other comorbidities associated with renal disease. So an absence of adequate diagnosis renders the line of care totally ineffective for these patients. And there are other treatment options such as peritoneal dialysis that allows patients to be treated at home without healthcare professionals, with self-care. But unfortunately, due to the lack of payment increases by the public health system, due to the lack of economic incentive, this type of therapy is practically being extinguished in the country. And now to talk about remote work, I will share experiences, our back office experiences, quite similar to that of our colleague José at the Oswaldo Cruz Hospital. And we didn't know if it was going to work or not in the beginning. And we know that the back office activity in the healthcare industry, if it does not work well, it will have an impact in the treatment outcome and even result in death for the patient. So our experiences were quite similar, so much so that I am here working from home I've been going to the office twice a month, mostly to meet people in person, but we've been having strategic meetings, acquisitions, restructurings, and things that we could never imagine that we could do remotely. And we are perfectly adapted to that. So I brought a few examples. Fresenius believes that in the future of dialysis will be much more like a self-care treatment that you can do from your own home. So following that perspective, in 2019, Fresenius made substantial investments by acquiring a company for $4 billion in the United States, where we acquired a portable dialysis system to be used at home for self-care. And all of the data resulting from that treatment is transmitted to a medical team that's located remotely. And that gives us a very clear example of how remote work can help frontline workers. In Brazil, we also have this treatment option, kidney dialysis at home, but currently you have to have the assistance of a healthcare professional. And for that segment, and in the before we would do at-home visits, we implemented a series of processes and protocols, and now we're able to do a tele medical appointment, and we use a checklist, and by having trained professionals, we can assess if that patient's home is eligible for that or not. Another interesting observation that I want to share with you from the perspective of treating renal patients is that usually they have lots of comorbidities. We have an app called My Comorbidity that allows for a quick interface and with other physicians that participate in the line of care of that patient, with cardiologists, endocrinologists, pediatricians, and those professionals can follow up the history and evolution of these patients remotely through the app. I also want to mention our training center, which started operating remotely. I don't know if you're aware of it, but around 30% of patients intubated due to COVID need a very specific acute dialysis called continuous dialysis. And Fresenius, it was in October 2019, it brought to market a device called Infiltrate. That was before the pandemic, and we had plans for bringing this equipment to market and training people. And we were actually hit by the pandemic and surprised by it. And overnight, we were hit by a huge amount of requests and demands, and we could not train people. So we created a protocol for remote training for healthcare professionals that could use that device to treat intubated patients. And that was very quick. And it was truly gratifying to see that we were able to train an entire team of a hospital in the south of Brazil during a morning. And in the afternoon, we were training a different team from a different hospital in the north of Brazil. So things that certainly, if it were not for remote work, they would never be possible. And I'm sure that Fresenius was able to help save some lives due to this initiative. And I also want to mention we have a TDMS system, as we call it, that captures dialysis data directly from the devices. And with it, we're able to, within a period of 4 hours, which is usually the time frame taken by a dialysis session, we can return data to professionals in 40 minutes and reliable data. But the use of this TDMS along with our clinical data management system, Nephro system or others, it allows for the creation of an online database that transmits in real time to healthcare professionals information about every treatment that's taking place at the center, allowing a doctor in charge of the clinic to manage the treatment from anywhere. And they only need to have an internet connection. And I want to explain that this traffic of information follows all of the guidelines of the General Data Protection Law. So with that, Alexandre, I wanted to give you a few specific examples from the dialysis clinic. And I want to highlight that this is a very incipient subject. 5G is around the corner. It will allow for extremely fast data exchange around the world. We have the metaverse, and we also have social networks, but the FDA has 12 platforms already approved, focusing on healthcare using the concept of metaverse. It's very hard to predict every possibility that remote work will bring about for the healthcare industry, but I can assure you that in 5 years' time, we're going to be seeing a very different reality. I had the opportunity to watch a different discussion. And there was something that one of the speakers said that was very interesting. And I want to quote him. He said that doctors will not be replaced by technology. They'll be replaced by another physician that's willing to use technology. Of course, he gave the example of a medical doctor, but that can be applied to any professional. If we do not adapt to technology, if we do not use technology in our favor, we're going to be hit by that wave and others will come behind us. That's inevitable. If we could block out technology and stop the future from happening, we would still have chariots traveling our roads. So I would invest our time and energy in trying to learn these technologies and be part of them. But this is a fundamental discussion talking about the countless possibilities of remote work. And it's a pleasure to be part of this panel and somehow be able to contribute. Alexandre, you have the floor.
Excellent, Edson. Thank you. We have a question on the chat, and I'm going to organize things and address questions separately. So we have a question here for Dr. Oliveira, which is, what was the impact on productivity for the associates that work, especially in the part of the relationship between suppliers and all the support you have in the hospital part with doctors and hospitals? So we have a large demand or visits or physical relations that are appointments that existed in the hospital and all the companies that provide services to the hospital. And this relationship somehow was no longer physical and started being remote. Any insight, any reading of the trend in the relation as to how companies relate to hospitals considering this transformation? Alexandre, the reflection I made, we are not yet living a normal relationship because the solution of remote work, home office, is still being developed, in my opinion. And we have not seen, I think we had it equal or some points, but very likely of a personal, due to a personal effort of adaptation. And not with a structure vision, and not with all the tools and everything. On the other hand, Edson gave various examples, caring for a chronic patient, that this patient can benefit from these evolutions, but I think it's, well, structuring this solution, productivity tends to increase and quality as with that. And migrating to digital platforms that enable much more traceability, predictability, and resources and complementary resources to human capabilities as AI, remote monitorings, etc. So on the interface of support to the teams, I haven't seen any critical issues. It's being equal or even better. And I think this tends to increase considering the maturity we're going to have in the environment of providing services. I'm talking about service providing environment. Before I ask Edson a question, Dr. Oliveira, a question, a viewpoint from somebody who designs a strategic vision of institutions, the impact that this gradual transformation has made to hospital institutions. Do you envisage? Well, actually, a hospital, if you plan building a new hospital from the architect standpoint in a different way, actually, in which this relationship actually interferes in the very structure as to how the hospital is conceived. I'm not talking about a ward, ICUs, etc. How do we consider the idea that we have a society of the physical structure of the hospital? We reflect a lot upon that. This is part of our strategic vision. The hospital today has virtual elements. So we see a hospital that is increasingly more integrated to society with no walls. So the future institution has no walls. It has a large space for people to be together. So we have patients, caretakers, and other practitioners. And we have elements of education and health, because we have to train all these teams, the labor force, for another model, actually another mental model. So the development arms in terms of organization and capacity building and education, they increase in this vision of the future, because the institutions will have to train part of the skills of those professionals, because the time will be a bit ahead of the traditional models of information. And then another strong pillar is innovation and scientific research. So the patient, in terms of providing services, the patient is part of the process. So we have an interaction on the day-to-day. So when we see this moment of transformation that is quite fast, we will have to gain competence to create, to innovate, and to experiment. In the case of the Oswaldo Cruz Hospital, we have this feature. It is a space of almost 1,000 square meters of innovation. Since it is a more traditional hospital, it's been around for 124 years, the space is outside the hospital. Part of the doctors go there, etc. And the next design and space revision, this environment will be inside. And we make this connection. And the surgeon, they want the resources of virtual reality for their surgical planning. The ER doctor is monitoring a patient. They know the patient will require this, that. And many times the institution will invite patients to come to the institution. They realized clinical signs of deterioration before symptoms were present. In the previous, another motto is the patient needs to be engaged in their own treatment. All this advanced telework, well, what it brings, our healthcare has to encompass that. This is a very broad question, and I'll step back and let some room for the other questions. Perfect. I think it's a message to all our audience that we have no doubt that the structure of conceiving healthcare, even in the viewpoint of architecture of processes, is highly impacted, will be impacted, not only by technology, as Edson mentioned, a lot of technologies, but also based on the reality of remote work in several areas. Edson, a question from the chat for you. How, as industry, so there is a great need to provide technical service and provide medical information, products, innovation for the medical community. During the pandemic, a great part of that had to be transformed into an online appointment. So, what has been your experience in this remote work of somebody who works in this line of promoting a clinical product with doctors? How has this been seen? What do you think remains of this virtual relationship with this mechanism of work with the medical community?
I think one benefit brought about by the pandemic was that it forced 100% of the population in the world to do something at the same time. So if we hadn't experienced the pandemic, certainly we would be having this seminar in person, would have traveled to Sao Paulo because these were the models that we were using at that time. But the pandemic forced us to find a way to continue with our lives. And that was by embracing the virtual world. And since it was the only way available, everybody embraced it because there was no other way. And I think that, well, in the beginning, it was a very intense adaptation period where we would look at the cup being half empty rather than half full. But of course, the pandemic as a whole brought a lot of harm to our personal lives. But with time, people started seeing the benefits that they could extract from that, where sales representative would travel 100 or 200 kilometers to go to a clinic or a hospital to meet with a doctor, and the doctor was tending to an emergency and could not see him or her. So just as we mentioned about the back office activities, where some days you'll be working from office and most of the days you'll be working from home. I also think that this relationship with doctors, where you have to demonstrate new technologies, that will also adopt a hybrid model. And certainly it will no longer require people to travel to and fro long distances, and the visits are also going to become more frequent, and there will be a higher possibility of establishing good interactions virtually. And even these 200 kilometer long trips, which were quite unproductive in the past, now they're going to be different, and you're going to use that time to be connected with other customers. So as opposed to what people used to say, that this technology builds a gap between people. If you use it adequately, it actually brings them together. Well, that was an excellent subject. But the subject is great because it's transformative. It's a living subject, and it's dynamic. But we have, of course, time constraints because we have to start other talks and other panels. I'd like to thank our audience who is still connected, dedicating that time and attention to listen to these illustrious guests. And I also want to thank Dr. José Marcelo and Dr. Edson for their presence, for their explanations. and for this discussion. Since it's about remote work, I want to leave you my virtual regards, not only to you, but also to my audience and the FIS team. Thank you and have a great day.